Are you turning 65 soon? Are you suddenly extremely popular and you're getting Medicare phone calls at all hours of the day and night? Are you getting tons of mail with insurance propaganda and marketing and advertisement that's full of fluff and you don't understand a thing? My name is Franco Cavedo. I'm with South Coast Medicare, and in this video, I'm going to explain it all and demystify what's going on. If you are confused by Medicare, that's extremely common. We get phone calls from lots of people. They're very lost. They're very confused. They keep seeing all these Joe Namath commercials and Joe Mike Ditka commercials. It's funny, they always use the football guys. You know, showing no monthly premiums, free gym membership, prescription drug coverage, the Medicare coverage helpline. Call 1-800 whatever. And these commercials are on at all hours of the day, all year, especially during open enrollment. And they never really get into too much specifics. So guess what? It's pretty confusing, right? So in this video, we're going to go over Medicare. And let me show you what I'll talk about. We're going to talk about what is Medicare. So to be clear, Medicare is health insurance, not retirement, not your pension, okay, not a 401k. Medicare is health insurance. Doctors, hospitals, prescription drugs, medical related things, health insurance. People get confused because you get Medicare when you turn 65 years old. So that's where the kind of confusion comes in, because you're also making retirement decisions and pensions and thing also come to mind. But Medicare is strictly health insurance. So South Coast Medicare, that's what we do. We help with Medicare health insurance. Okay, so we're gonna go over Medicare, the basics of Medicare. What does it cover? What does it cost? Okay, the types of Medicare plans. Within Medicare, there's many different types of Medicare plans. That's why you're getting all the mail from different insurance companies. So we're going to show you, break it down. It's basically 3 types of Medicare plans. So I'll simplify it for you. We're going to talk about the different insurance carriers that you've heard of. They're the ones sending you mail and they're on all the TV commercials. Okay. And then we're going to give you some information and see if we can help you select the Medicare plan and show you how to enroll. Alrighty. So let's get into it. Okay. Original Medicare. So what you see right here, this is a Medicare card. This is what it looks like. They call it the red, white, and blue card. It's made out of paper, just like your Social Security card. The same material. It comes from the Social Security. Actually, Department of Health and Human Services, but you'll get this in the mail, usually 3 months before you turn 65 years old. If you don't get it 3 months before you turn 65 years old, there is a way to call in or apply online to make sure you get it. Especially if you were born outside the country and you're a naturalized citizen, usually this doesn't come automatically. You got to take a couple extra steps. They just want to verify your identity and your work history. But this card is the original Medicare card. Okay. And when you get it, it'll show your name. It'll show a Medicare number. It used to be your Social Security number, but they changed that for identity protection purposes, which was a good call. And it'll show what you're entitled to, Part A and Part B. On this card, it will only ever show Part A and Part B. Sometimes it might show just one of the two, but it'll never show more than Part A and Part B. What is Part A? Part A covers your hospital coverage, surgeries, anything in the hospital. Okay, just the simplest way to put it, covers your hospital charges and coverage. B, medical. That's basically anything outside of a hospital. Doctors, okay, MRIs, CAT scans, anything outside of a hospital. All right. This does not cover 100% of the things outside of the hospital, okay? And it also is not for things like cosmetic surgery. Nothing to do with cosmetic surgery like Botox or something, or an augmentation. This is for medical purposes outside of a hospital at a doctor that accepts Medicare, which is about over 90% of doctors in this country, okay? One thing to know, if you have worked less than 10 years in this country, you don't automatically get Part A completely paid for. If you've worked at least 10 years in this country, or you're married to someone who has, then you get Part A for free, covered. You don't have to pay for Part A. All right. And here are the dates when your coverage starts. So you'll notice sometimes you get this before you turn 65. Say right now it's February 2021, and my 65th birthday is in May, and I get this card right now in February. It'll show 0501 2021, because that's when my 65th birthday is, the month of May, and it'll always show the first of the date. Okay. Now, you'll notice here does not include Part D. D stands for drug plan, prescription drug plan. That won't show up on this card here. Okay. And you are somewhat obligated to get a Part D drug plan, or else there is a penalty. You are also somewhat obligated to get Part B or have an equivalent insurance. So in the letter in the mail where you get this card, it'll say, if you do not want Part B, fill out the card and send it back. Why does it ask you that? Because it gives you the option, right? Everybody gets Medicare. But the one big surprise, it's never really advertised, even though you've worked your whole life, right? You've been taxing all your paychecks for Medicare. You still have to pay for a portion of Medicare. Okay? And usually it's just Part B. All right? I'll show you what that cost is in just a little bit. But sometimes, if you're a government worker especially, and you've been in that position a long time, like if you're a police officer, you have a pension, or you're a firefighter, or some other government job, or maybe you're in a really good company that takes care of you for life, pension, it's not too common these days, and you can go with that pension plan that you provided, and you don't have to do Part B, because Part B does have a monthly premium cost. It's as of right now, it's $148 per month. That's from the government. That's before you call Joe Namath on the telephone and get your Medicare plan. That's before the actual insurance plan, the carriers, which you don't have to get. You can stick with just this Medicare card, original Medicare. But if you do, there's deductibles involved, there's cost involved, and let's look at those. Let's see what those look like. Okay, so here is a breakdown. Let's see if I can move my picture here. Okay. Here is the breakdown: 2021 Medicare costs and premiums with just original Medicare. Remember, this card is original Medicare, just this card, okay? That's referred to as original Medicare. So if you keep just this card and you don't get any additional insurance, then this is what your cost structure is going to look like, okay? So Part A, you're not paying a premium because you've worked for 10 years at least, but you still have deductibles involved if you go to the hospital. So your deductible for Part A is $1,484 per benefit period. So that's once every 60 days is a benefit period. So within a year, you have, I guess, 6 benefit periods, right? 60 days. Bump, 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 bump. So if you're in and out of the hospital throughout the year, you're paying this deductible, $1,400, $1,400, $1,400. Okay. Co-insurance, days 1 through 60, 0 per day, each benefit period. If you stay after 60 days in the hospital, it's $371 per day, each benefit period. So that can add up. And if you're after 90 days, $742 per day. You only have 60 lifetime reserve days. Okay. Usually you're not in the hospital for over 3 months straight. Okay. That's not too common. So those are the costs involved with Part A if you just have original Medicare, just the card. Part B, let's go into the cost first. The premium cost I was talking about. Even though you've worked your whole life, right? You've been paying taxes through your paychecks, paying for Medicare, you still have to pay for Part B. no matter what, unless you have Medicaid. That's the low income government insurance. They will pay Part B for you if you qualify. But for most people, you have to pay for Part B. And for most people, that premium is going to be 144. I mean, excuse me, used to be last year was 144. 2021, it's 148 and 50 cents. I believe it's actually 60 cents. But same thing, $148 per month. Oops. Per month. Okay. How do you pay that? There's a couple different ways. The most common way, if you're already getting your Social Security check, they will just deduct it out of your check every month. If you're not getting your Social Security check, you're going to get a bill in the mail, and it's a quarterly bill. Quarterly meaning every 3 months. So it'll be a 3-month bill of Part B, 148 times 3. That's about $480 or so. Let's see, 148 cents times 3, $445 every 3 months. Okay. If you don't want to pay a quarterly bill and you prefer to pay monthly, you can do online bill pay through your bank. If you have Chase, Bank of America, any large bank, just go to the bill pay and look for Medicare. You can directly pay there. There's also there's a couple different ways to pay monthly. You can call also. Okay. And if you're looking at this here, right? So depending on your tax bracket, how much you make, if you make more than 88,000 for individual, joint tax return 176. If you make more than that, your Part B premium goes up. I've had customers who won the lottery actually. Not too much. It wasn't a mega million, but they won a sizable amount, and they got their Part B payment went up for a year or two. Unfortunately. Okay, but then we got it back down because you only win the lottery so many times. So if your income, here's the highest bracket. If you're over $500,000 or 750,000, if your joint tax return, then your Part B premium is $504 in 2021. Okay, and they also make you pay an additional for Part D if you're making that much. And that all depends on your tax bracket, right? Maybe you have businesses and your business collects the money and your income is actually less than that. And, right? That's something to do with your tax advisor. We do help with what they call the rich man's Roth, though, Index Universal Life. And that's one way to continue your 401k Roth IRA benefits and not pay too many taxes. So, but that's for another video. Okay, so this is the Part B premium monthly payment with just this card, right? Your Medicare card, original Medicare. You have to pay every month for Part B. As soon as you turn 65, the very first month. And that's the Part B premium. On top of that, there is a Part B deductible. It's $203 per calendar year. So $203 per year, one time, for the Part B deductible if you're going to the doctor or a specialist. Okay. After that, you're going to pay about 20% of the cost of whatever you're being billed for at the doctor, the lab, or whatever is outside of the hospital. You're paying 20%. So that can turn out to be, a few hundred, a few $1,000s. Depends what you're doing. If you're buying medical equipment, you're paying 20%. So that can add up a lot. Okay. So, sorry. What about your Medicare plans? All right, because original Medicare, right? Just this card, original Medicare is not necessarily a plan. There are plans that will cover these deductibles and copays, so you're not forking out cash all the time at the doctors. And there's different types of Medicare plans. Okay, you have Medicare Supplement plans. If you've ever heard of Plan F, Plan G, N, K, L. Those are Medicare Supplement plans. We'll go over distinguish them between Medicare Advantage plans. That's the other type of plan. and you have Part D prescription drug plans. So of all the Medicare carriers, insurance companies, and plans, there's hundreds of different sub-plans. It all breaks down into three categories. Medicare Supplement, also known as Medigap, just a different name. Medicare Advantage, also known as the Medicare HMOs, also known as Part C sometimes. And then you have prescription drug plans, Part D. Those are the three categories. Let's distinguish them. What is the difference between Medicare Supplement versus Medicare Advantage? Okay, Medicare Supplement, not an HMO or a PPO, similar to a PPO, but better, in my opinion. Okay, what does HMO, PPO even stand for? HMO stands for Health Maintenance Organization. Basically, that would be the insurance company, the medical group. They maintain your health plan, kind of. You have an assigned doctor, etc. And usually you hear of issues where there's a certain medical group and a network, and you have to stay in the network. That's more defining of an HMO. PPO means Preferred Provider Organization. So people have come to equate that to having access to higher level doctors. And you can go to other providers outside of a certain network. With Medicare Supplement, there is no network. You go to any doctor that accepts Medicare, and about over 93% of doctors in this country accept Medicare. Guess why? Because everybody who works pays taxes, and they pay into Medicare, so the honeypot is big, and the doctors, they do what doctors do. They want to put their, get into the honeypot of gold, of Medicare gold. So, you can basically see any doctor that accepts Medicare, which is pretty much all of them. All right. No networks, no referrals, no authorizations with a Medicare Supplement plan. The most popular Medicare Supplement plans: Plan F, Plan G, Plan N. Many different carriers offer those plans, and they have to go by the same structure. The only thing different is how much the insurance company charges for the Plan F, for the Plan G, for the Plan N. Okay, we'll go into a little bit of that in just a sec here. With a Medicare Supplement plan, you don't get the extras. So if you've seen the commercials with Joe Namath, Mike Ditka, they're on TV, they're talking about free this, free that, free everything. We'll give you everything. Those aren't with the supplement plans. Okay, you don't get the dental, vision, hearing, gym memberships. They are starting to offer some of them for an extra cost because people want them. But usually they don't come with the Medicare Supplement. What's the other side? Medicare Advantage, sometimes called Part C, sometimes called Medicare HMOs, sometimes called MAPD. It's an abbreviation of Medicare Advantage Prescription Drug. Because these Medicare Supplement plans, they don't include drugs. You have to get a Part D separate. That costs money every month. Medicare Advantage, some of them do come with a prescription drug plan included. So with a Medicare Advantage plan, it's technically an HMO, Health Maintenance Organization. So that means you're in a network, right? And is that good or bad? Depends on the network. I'm out here in Southern California. We have enormous networks, and all the doctors are pretty much in them. And it's easy to see which doctor isn't and is not. So here it's a good thing. It's not a bad thing. But if you're in somewhere where it's not a large metropolitan population or an obscure area, sometimes there's funky networks out there. So we'll get into that in just a sec. So with a Medicare Advantage plan, you're assigned a primary care doctor. You pick who you want to be assigned to. So I'll say that again. You pick who you want to be your primary care doctor. Okay, and you can always change that doctor. Once a month, you can change who your primary care doctor is. So I have another video on how to find any doctor, whether it's a primary care or a specialist, and how to determine if it's a good doctor, how to determine if you like the clinic they're in. If you ever drive by a clinic on the freeway and it's brand new and you say, hey, I want to be there, How do you look up those doctors and assign yourself to the doctor? I'll show you how to do that in another video. How to find a doctor. You can also go to our website, southcoastmedicare.com. Got a big button on there, how to find a doctor, but it's a little tricky, a little technical. So watch my video on how to find a doctor. Okay. With a Medicare supplement plan, you don't assign yourself a doctor. You're not assigned a doctor. That doesn't mean you have no doctor. You go to any doctor you want. And if you like a certain doctor, you keep seeing them, and you don't need an assigned registered doctor. Here you do with a Medicare Advantage, because that assigned doctor is the one who gives you authorizations to see a certain specialist. Okay, they write their prescriptions. Okay, seeing a specialist to undergo process procedures, it requires referrals and authorizations, which aren't hard to get, and sometimes you can even get them over the phone. Okay, you just got to know how to kind of work the system to get what you want. These plans, the Medicare Advantage plans, they're the ones that you hear about on all the advertising. You get a lot of extra benefits: acupuncture, chiropractor, free gym membership, which is great. 24-hour fitness, LA Fitness, Gold's Gym, YMCA. You can go to all those gyms at the same time for free. I closed my account because it's coronavirus time and I can't work out with the mask on, but I was paying $45 a month for 24-hour fitness, which isn't bad, but if you can get it for free, that's great. And so that's nice. They give that to you for free. You should be working out. It's great for your health, right? So they want to keep you healthy. All right, so these are the Medicare Advantage plans. They offer all the extra goodies. Let's dig deeper into what this costs, actually. This $0 cost on TV, is it real? I'll show you. All right, so we'll start with the Medicare Supplement plans. And this plan is going to be specifically the Plan G that we'll go over, okay? What's the copay to see a doctor with the Plan G? $0. There's no copay. You want to see a specialist? $0 copay. No copay. You're not paying to see a specialist or a doctor. If you're in the hospital for any surgery, anything at all, inpatient, where you're staying overnight, $0. $0 with the Plan G. All you have for this plan is the $203 deductible. That's it. That's it. And you pay a monthly premium. That premium is anywhere from $300 a month down to $130 a month. What determines that? Your age, your zip code, and whether you were a smoker or not. So age, zip code, and smoking. Okay. So to get an exact quote, you have to either book a call with me, and we type in your information and get it popped out. It's real quick. So there should be a link somewhere. If you want to get that quote, just book a call. Doesn't cost anything. Takes a few minutes. Okay. With a Plan G, the drug plan is not included. So you have to pay for the Plan G, which is anywhere $300, $130 a month, plus a drug plan for your medicines, which they kind of obligate you to get. You wouldn't want to be paying cash for drugs anyway, so get the drug plan, and the drug plan is anywhere from $20 a month to $120 a month sometimes, and plus copays. Okay. The copays for these drugs, generally for the generic medicines, those are the one in orange bottles. Copays are going to be cheap, $5, sometimes $0 if you're paying a high monthly premium. And then for the brand name medicines, those are going to have a higher copay, $40, $35. If it's a tier 4 drug medicine, $95, $100. Okay. Drugs are broken down into tiers. The first 2 tiers are generic. The second 2 tiers, tiers 3 and 4, those are brand name, more expensive. Okay. If you do not choose to get a drug plan, there is a 1% penalty per month per year. Doesn't come out to too much if you don't get it. Okay. And that's from the government, basically. So this is a basic summary of what a Plan G looks like. Okay. You have to get a drug plan. It costs so much per month. It depends on which drug plan you choose. There's a bunch to choose from. Okay. and they're always kind of changing every year. So it's a good idea to consult with someone like me, a licensed health insurance agent, and we'll get the latest pricing. Because every year the plans change a little bit, new things come out. Okay. And so you're paying for the drug plan, you're paying the monthly premium, you're also paying the Part B. Remember? Part B. This is before you get a Medicare supplement or an Advantage plan. You have to pay Part B no matter what. That's directly to the government. So let's go over, remind you about this again. Look at Part B. This is Part B, right? You pay this before you pick an insurance plan, Medicare plan. Doesn't matter which plan. You're going to pay Part B. That's step one. Get your original Medicare. Pay for Part B. 2021, it's $148 a month. Okay, it does go up every year, unfortunately. Okay, so step one, you pay for your Part B, and if you're going to get a supplement like a Plan G, you pay for the Plan G, and then you pay for the drug plan, and that's your total. And these are phenomenal plans. Go to any doctor, no copays, much cheaper than some covered California plans, most covered California plans. Okay, let's look at the other side. Medicare Advantage, the HMOs. You probably noticed, oh my gosh, it's the same. What's the difference? What's the difference here? Doctor, $0 copay. Specialist, $0 copay. Hospital stays overnight, $0 copay. Same hospitals, same doctors, 0. Okay. You get extras, depends on your county. Not all counties offer it. Even though it's the same company, say it's AARP, United Healthcare, right? They're all over the country. They're the biggest. If you're 3 hours outside of here, different county, you might not get all the gym, the dental, the vision, the hearing. Okay, it depends on the county and what they offer there. So that's why we say give us, book a call with us so we can look at exactly what they offer in your county, and we'll compare. But in LA, Orange County, Riverside, Inland Empire, very rich Medicare Advantage plans. You get basic dental, you get vision, you get hearing, you get gym, you get chiropractor, acupuncture. I just got a great chiropractic adjustment. This is good for you. This is good stuff. Over-the-counter products. Let me show you some over-the-counter products that they include. Stuff like Tums, Pepto-Bismol, vitamins, stuff you get like at a CVS, just over the counter. They'll give you a credit, anywhere from $100 to $400 per year, just to get that stuff for free. Hope you can see this on the screen. This is the United Healthcare catalog for 2021. See, you got toothpaste, first aid kits, bath salts, vitamins, Claritin. This is the Walmart brand. You get Walmart stuff. Equate. Durable medical equipment. Bandages. Compression socks. Vapo rub. Cough drops. Cough medicine. Mucinex Advil. Fiber supplements. Mylanta. Gas relief. Pepto-Bismol. Lactaid. If you're lactose intolerant. Eye drops. This is great. All sorts of stuff. All sorts of stuff. Band-Aids. Anti-itch cream. Antibiotic cream. Neosporin. Hydrogen peroxide. Alcohol. Disposable face masks. There you go. If you see these prices, that's what your credit gets applied to. That doesn't mean you pay it unless you go over your credit. Aveeno. Aveeno's a good brand. Soothing bath treatment. Bath salts. Body powder. Athlete's foot spray. You got a lot of products here. You got basically everything. Thermometers. Ear scans. Women's products. Toothbrushes. Fancy toothbrushes. Floss. There's a whole bunch of stuff. You get everything. I hope that came up on the camera. If not, I'll have to edit it in. That's included in these Medicare Advantage plans. How much does it cost per month? In LA County, zero. You have a lot that have zero premium. Have zero premium a month. It's real. It's true. How is that possible? How is it $0 a month? I'm going to show you a plan just in case, some people find it hard to believe. Let's see. I hope y'all can see this. So this is a local plan down here. It's not one of the big national ones, but they're great. Okay. Here it is. Monthly plan premium, $0. Annual plan deductible, $0. This is Scan Classic. They have a couple different sub plans. We're looking at the Classic. Primary care, go to your doctor, $0. Specialist, $0. Diabetic self-management training, $0. If you're diabetic, you need supplies, the Lancets, test strips, the monitor, included, $0. Annual physical, $0. Preventative services, like a coronavirus test, $0. Lab services, x-rays, that's blood work and x-rays, $0. Diagnostic tests, procedures, $0. Outpatient rehabilitation, like physical therapy, $0. Diagnostic radiology, MRIs, CAT scans, ultrasounds, $0 for the first time ever in 2021. That's great. Durable medical equipment, wheelchairs, things like that, $0. You're not paying 20%. You're not paying cash. They give you everything. Inpatient hospital care, $0 per day, unlimited days. Say that again. You stay overnight in the hospital. Any hospital. Just depends where your doctor's assigned to. Okay, so get yourself assigned to a good network. Go to Torrance Memorial. Go to Cedars-Sinai, UCLA. $0 per day, unlimited days. Just got to make sure the plan and the network are in the network for that hospital. And all hospitals work with insurance. So you just got to find the network that they work with. Very simple. $0 per day, unlimited days. Skilled nursing facility, $0 per day for the first 20 days, $50 per day for days 21 through 100. Outpatient surgery, that means same day surgery. You're in and out. You're not staying overnight. $0. ER, emergency care, $90 worldwide. Go to any hospital in the world if you have an emergency. You're on vacation, you get, something happens, go to the hospital. You have coverage from this plan for $90. Pretty remarkable. $0 if admitted immediately. What does that mean? My interpretation is if blood is coming out of you and you really need to be in the ER, they will charge you a copay. I think they do that so people aren't abusing the ER rooms for, their pinky hurts. They got a bellyache, right? Make sure it's for people who really need it. Urgent care. So that's for instances where it's not as, where it's not an emergency. $0 worldwide. Say you need, you ran out of your prescription medicine and your doctor can't see you for a couple months. Go to an urgent care and they can give you a temporary prescription right then and there. That's kind of what urgent care is for. Or you can't sleep at night, need some medicine. Want to see a doctor, go to urgent care. They're open. Some are open 24/7. Your biggest copay is going to be an ambulance. $200, not $2,000, not $20,000. Thank God. I'm sure you've heard horror stories. You go 2 blocks and they charge you $2,000. With these plans, you're covered. $200. That's your most expensive copay, for the most part, unless you have cancer and you're doing chemo. Annual max out of pocket. So that means the most that they can charge you in a year. This is for your financial protection. The most that your copays can accumulate to, in this case, is $799, $800. That's great. And guess what? All your copays are zero anyway, so you're probably never going to get there. But if you do, you got that, peace of mind that it'll never be above this. That means in 1 year, you'll never have a $10,000, $30,000 medical bill. Never. With these plans. With the plan, with the MAPD, Medicare Advantage Prescription Drug, you get the drug plan included. You don't have to pay for it separately like you'd have to do with a Medicare Supplement plan. Medicare Advantage plans, MAPDs, they have the drug plan included, so you're not paying monthly for the drug plan. And in this case, no deductible, $0 deductible. And look here, if you're at a preferred pharmacy, your tier 1 generics are free, $0. They get mad when we use the free word, so I'm supposed to say 0. There you go, 0. You're not paying for tier 1 drugs. Tier 2, $5. The price of insulin went down huge. That's great. There are some complications, though. The recent election and the new guy who came in there, he's kind of combating some progress that was made with insulin medications. So this might go back up. But hopefully not for now, since it's in writing and contracts have been written and made. We'll see. Tier 3, otherwise $37. Tier 4, those are the brand name drugs, $95. Tier 5, those are specialty tiers. Those are for serious illnesses, medications. Okay. And these plans include basic dental. If you want extra dental, it's worth it to pay a little extra to get the extra dental plans. And here's some of the extras you get. Look at all these extras. This is a Medicare Advantage plan. This is the extras you get. Vision services. They'll give you $175 for frames or contact lenses. Dental services, you get free exams, 0. Free cleaning, 0. Free deep cleaning, 0 per quadrant. So you have 4 quadrants in your mouth. It's just dental terminology. Normally it's about $500 per quadrant, so $2,000 for your whole mouth. Here, all covered. All covered. Always watch out for dentists. Don't let them yank out all your teeth at once. Transportation. This plan includes medical. This is new. Non-medical transportation. Not available? Oh, it says not available. Supposedly they're going to make it available this year. But basically none of the plans do that. They include medical transportation. It's basically like an Uber. It's private. It's a car. Takes you straight to your doctor's appointment. Picks you up. This is great, especially for seniors who can't drive. And in Los Angeles, you don't want to drive anyway. There's tons of traffic and parking's crazy, so this is real nice. You don't have to worry about any of that. Okay, routine acupuncture, chiropractor, therapeutic massage. That sounds great. $15 per visit, 30 visits per year. Sign me up. When I turn 65. Telehealth, Viagra. Look at that. You get 4 tablets per month. What more can you ask for? Scan health, over the phone appointments, scan on the go. You get so much benefits. These plans are really benefit rich. Health club membership, that's the gym, through Silver Sneakers. I'll show you the Silver Sneakers websites, all the gyms you can go to. Over the counter. This plan gives you $30 per quarter. That's about $120 a year. Fitbit. Scan gives you a Fitbit. As far as I know, they're the only plan that does that. Fitbit is the watch that tracks your heart rate, tracks your sleep. It's a monitor. It's like a health watch, wristwatch. You wear it, it comes with an app, shows you all different diagnostics. Pretty cool. You get that for free with the plan. Brain HQ, that's a new thing they've added. Online games to keep your brain healthy and active. Trivia. I like trivia. Okay. So that's just one of the plans. The Medicare Advantage Plans. And you saw it right there. $0 premium, $0 deductible. How in the world is all that zero? Because they plug in to your Part B. They plug into your Part A. They plug into the government. And they charge the government. I don't get to see how much they charge because it's the doctor's offices. I'm kind of curious about that, the medical billing. It's a whole other side of things. But hey, for you, all zero across the board. So those are your two basic types of plans. You have your Medicare Supplement. You have your Medicare Advantage. With your supplement, you have to get the extra drug plan included in there. So that has a cost. The supplement plan has a cost. And then with both, you're paying for Part B already. Right? So with Medicare Advantage, you're paying for Part B, whether you have Advantage or not. The plan doesn't charge you. The plan premium is $0. You're paying for Part B no matter what. Unless you have a pension plan from work, you're a government worker. And even then, maybe you don't want your pension plan. Maybe it's not that good. You still want the Medicare Advantage plan. Because, hey, $148, if the rest is $0, not bad. Really good. Okay. So just to go over what we went over, this is a summary video just to get you more familiar, just to help you get less confused. It can be so confusing out there. I get it. You know, as a licensed health agent, we have to take tests every year. And even for us, oh my gosh, it's like they try and confuse us every time. But really, I like to keep things simple. I'm transparent. I have nothing to hide. I'm not big pharma, big insurance. I'm here to help you break things down. So what we went over was your original Medicare card, right? The red, white, and blue card, the paper one you get in the mail. Okay, should be arriving through the mail 3 months before you turn 65. Okay, if you don't get it before you turn 65, you can order it online or call on the phone, or help us. Have us help you. We'll help you get it. Okay. And number 2, determine whether you want to keep Part B. Do you have a pension plan? Does your wife or a husband have a pension plan that you can hop on and stay on it for life? Is it going to cover you for life? That's what you need to figure out. So usually it's only if you're in a union, a good union. How long you been in that union, right? You got to get their 20-year union pension plan. Or if you're a government worker, okay? So figure out if you want to keep Part B, or if you want to be with your union or government or pension plan for health insurance, okay? If you decide to keep Part B, great. Now you just have to pick a Medicare plan. Is it going to be a supplement? Is it going to be an Advantage plan? Who's going to be your doctor? Who's going to be your medical group? Which hospitals do you want access to? Okay? And then pick your Part D plan. If you pick a supplement plan, pick your Part D plan. Okay, there's a way where you can look up the cost of all your medicines with all the plans and figure out which one's the most economical, the cheapest. Okay, so then make sure you have access to all your doctors, to all your medicines, all your medical networks. And once you're sure of that, enroll to the plan. Enroll to the Medicare Advantage plan or the supplement plan. Okay, and if you need help with that, that's what we're here for. There should be a link right below or right above. Book a call with me. You'll speak with me. It doesn't cost anything. Okay, and it's quick. Takes a few minutes. And if you have extra questions, we'll take the extra time. We'll go over everything you want to go over. And we'll figure out which plan is best for you. I'm licensed in California, Florida, and soon to be many other states. Okay, so you can call Joe Namath. Speak to a call center in India or who knows where, or you can call the local agent like myself. I'm Franco Quevedo, South Coast Medicare. I hope this was helpful. leave a comment. If this is on YouTube, leave a comment below. Let me know what you liked, or if you need help with something, or you want me to go over something else, let me know. Give me a thumbs up. And I hope you all stay healthy, happy, and full of wealth and love. And God bless you all. Have a great day.